Okay.
Oh, that's nice.
So I'm keeping it pretty simple.
So the live has just started. Welcome back everyone to Pre-Dental Universe. We are having Dr. Jackson again with us today. She will be focusing on showing us cases in prosthodontics, and we're very glad to have her with us this afternoon. And let's get started.
Great. Thank you again for having me, and thanks to those who are coming back for a second dose of some prosthodontics. I'm sure you could be doing something else with your afternoon, but thanks for being here. Let's go ahead and get right into it. I have, I believe, 7 cases to share with you guys, and feel free to write down your questions if we want to wait till the end, but I'll be happy to answer any questions you guys have. Okay, so first case we have. This patient, when he arrived, he was telling me that for some years, he had been doing his own patchwork at home, largely off of or using materials he bought online on Amazon. And it finally got to the point where the adhesives he was purchasing and those front teeth, it just wasn't working anymore. And so that's when he knew he had to come in. He said that approach was just to buy him some time because he knew that this treatment would be very expensive. And he was right. But I'm glad he came to us, and I'm glad that he stopped using super glue and everything else he found online. And so when he came, you can see that he's missing several teeth. On the lower arch, he only had the front teeth, and he had very significant tooth wear. If you can see here, I don't know. Oh no, I don't have an arrow, but the bottom right, the bottom picture to the left, the second one to the left, you can see the significant wear, where you can see actually the second layers and even into the pulp space of the tooth, which is where you see that yellow color there. So he had wear, he was missing back teeth, which is very important for support of the jaw forces, and also some front teeth that had a lot of decay. He had existing implants as well. And also, you might not be able to see, but he had an implant placed on his lower left that actually fractured off completely. So we have a patient with multiple missing teeth, a very strong, super strong bite, and we need to design his entire smile again. For him, we decided to go with a full arch fixed in place restoration up top after extracting his remaining natural teeth that were broken off there. And on the lower, we also decided to start fresh and get rid of those worn, broken teeth on the bottom, and also place in a full arch restoration, the one that was removable, it snaps in and out. Ideally, we would have had both the top and bottom fixed in place, non-removable, but this was the starting place to get him to a better place and really just a place of health. So a lot of times we have options for patients. All right. This next one is just a case example of a single implant. I have here, this is not Burger King. And that's just to say that, we live in a day and age where people want stuff right now, like literally like right now. And in dentistry and in other realms, it just doesn't work like that. And so for this patient, he had been missing that tooth for quite some time. And you can see on the very left, the top left, that when a tooth is removed, the bone is going to shrink away. The gums are going to shrink away. And that's just simply because your body is not going to expend the energy to keep that tissue around. And so with that, when planning for restoring, we oftentimes have to rebuild the foundation for an implant to be placed and ultimately a crown or a tooth replacement there. And so that's what we had to do here. And that takes time. That takes some healing time of the body that you can't expedite, you can't speed that up. So for him, we went ahead and did some bone grafting. We let that heal for about 4 months, came back and placed the implant, let that heal for another 4 months until he got the final crown or restoration. Okay. There are instances where we have patients who maybe lost a tooth, or even some patients who maybe has had the tooth like fracture off at the crown where the actual root is still in the bone. And in those cases, it can be very helpful if there's no infection, because the root tip actually serves as a placeholder for your implant. In other cases, when the tooth was lost fairly recently, we still have the bone. We need to go ahead and do what's called an immediate implant placement, where the tooth comes out, implant goes straight in. So those cases happen. And it's really, really fortunate when we have those instances, but it's also nice to have another way to treat these patients when that's not the case. Digital technology is a big part of dentistry in general, and also prosthodontics, the specialty. It's really cool because it's continuing to evolve so much, which is a lot of fun. In my program, I got a lot of exposure to digital dentistry. We had a lot of software where we learned how, from the very steps to scan um, the patient. And so we can have an intraoral scan that we can use. And from there, we can take everything into the digital realm after the patient has x-rays, and we can merge the x-rays with the scan and plan for the final restoration. And we can do that with pretty good accuracy, which is also neat. There's a lot of research in the digital technology realm that helps guide us in those areas. It's a lot of fun. This is the third case. This is an example of digital technology. And so this is a patient, a sweet woman who came in, and she had some crowns and she was wearing a partial, and due to the medication she had been taking, she had a lot of decay underneath all of her existing crowns and even on her natural teeth, to the point where her teeth were no longer savable. And so the plan was to get her into an upper denture and a lower overdenture. And with that, we were able to address one of her chief complaints her whole life was that she had a gummy smile. And so we were able to kind of reposition the teeth following pretty closely, the design that she naturally had, and create the design of the entire setup all digitally on the computer. And it turned out to have a very, very nice result. This fourth case. So this is a patient of mine, another very, very nice young lady with a history of cancer. So she had cancer 20 years ago. And one of our faculty there, who's been there for a very long time, was around when these implants were first placed 20 years ago. So, with cancer, with that type of diagnosis, there's always going to be some type of what we call a resection, a removal of the cancerous tissue. So she lost over half of her entire maxilla and the teeth associated with that. After healing, the initial healing, they went ahead and placed implants. They did a graft, I believe, from her thigh, actually, to place over the area. And she was back because she had a tooth that needed to be extracted. Her canine there, you can see on the left picture, was now loose. It had lost a lot of gum and bone support there, but also her prosthetic, it was old, and she was looking for something better looking. And so we were there to help her. As you can imagine, with what she had existing, the implant spaces, those gaps, served as a very large food trap. So that was a complaint of hers too. Food would just always kind of be sitting up there. All right. And so what we did for her, we went ahead and extracted that tooth. We added that to her existing or her new prosthetic. And that's what we fabricated for her, to also close up that space to limit the amount of food getting in there, which helped her a lot. And she was super, super grateful, and just a wonderful patient to work with. Case number 5. So this lady presented, and she said, I've been wearing a partial since I was 11 years old. And to me, I'm like, wow. She, at the time, was a 32-year-old real estate agent. And she was telling me her chief complaint about this partial and why she was ready for some new treatment. She came in because with the partial, as you can notice, there's that silver piece there that's showing in her smile line. And she's a young lady. She talks, all the time. The partial at this point was very, very loose. And so she was looking to get a new partial and also see what else we could do for her to improve her smile. And so from there, let's see, this is a close-up of what we have. With partials, meaning something that's a partial replacement, means it's removable. Means the patient has to take it in and out, and typically takes it out overnight as they sleep. You have to have something to hold on to. So you have to create something in your prosthetic that's going to attach to whatever is existing in the patient's mouth. And so upon removal is where this large defect was noted. And, when she first told me about the partial wearing, she told me the story of what had happened. And essentially she had a benign tumor. It wasn't cancerous, but it was benign. But it had to be removed, and removal of that tumor left her with missing that entire side of her maxilla and her teeth ever since age 11. And so, we talked about the option of maybe placing implants. But if I showed you the X-ray of her, you would notice that there was a lot of metal wire mesh put in the jaw to support the healing. And so that left us with basically no bone to take advantage of to place implants. So that option, which would have been the best option, was out. And so now we're thinking, okay, how do we improve the smile? How do we not show this clasp here when we need to be able to hold on to something? So what we decided to do was go ahead and fabricate a new partial with the retention piece actually on the backside of the tooth hidden, which worked out very well. But we also, if you can notice, that little side tooth there is pretty small and very much stepped back. So all we did was we crowned that tooth to bring it more forward. And the big tooth here on the left, the central incisor, that one was more forward, but also shorter than the adjacent tooth. So we said, let's go ahead and crown that tooth as well, those two, to make a huge aesthetic improvement in her smile. And so this is a case that shows that very small orthodontic movements can be made with prosthetic or restorations in some cases, right? If a patient needs braces, they need to get braces. But minor changes like this, minor subtle changes, can definitely be done with restorations. So that was pretty cool. And she was super happy with the outcome. This case, number 6. So this patient was a very sweet lady. This was the first patient I treated who actually had suffered from a stroke and subsequent mental disability that comes with that. Physically, she had no limitations. It was only the mental component from the stroke she suffered. So much so that, she struggled with remembering her name and her birthday. And so every time she would come in, I would ask her what her name is and her birth date, and we would say it together. And she was very sweet. The only thing that would be helpful in our treatment together was her singing. So she would sing all the time. And it was really challenging to treat her because you would tell her to do one thing and she wouldn't do it because she didn't understand, or just due to the mental deficit that was there. So that was very, very tricky. She had to have her implants on the bottom placed by oral surgery. They were able to manage that. I was able to manage her tooth extractions. But again, just a very, very challenging patient, almost, like an adolescent or a young child with a mental disability. Very challenging. But in the end, she was super, super happy. And just kind of one of those patients that really touched me. All right. And this is case number 7. So this is one of my favorite patients of all time. And when she first came, she told me that her story, and essentially she went to prison for 10 years for basically stealing from a bank. Okay. She then later on mid-treatment told me that she was in prison with Lauryn Hill. She was telling me that while in prison, someone told her, like, Lauryn Hill's in this prison too. And, you didn't see her the other day or whatever. And she didn't know who she was. So eventually she came to know who she was. And it was after the initial start of our treatment, she let me know, and we just kind of laughed at it together. And she's the sweetest woman ever. After, her release, she was into recovery. And I think at this point, she had been about 6 years sober. So that's kind of what got her into trouble at work, was her drug habit. And as you can see here, patients who have addiction, suffer from addiction, their teeth really go down pretty fast. And actually, her situation, her case wasn't as bad as we can see. She does have rampant decay everywhere, but the nice thing was that we were able to save a lot of her teeth. There were some teeth that needed to be extracted. So when first looking at this case, a patient with a lot of cavities, like what do you guys think would be the first step to do? Any guesses? Just wondering.
Remove the cavities.
Yeah, that's a good one. You want to, take care of the cavities and do some cleanup, essentially, and then see what you have left. Oftentimes, you have teeth that can be saved. You caught them just in the nick of time, and sometimes otherwise. So that's exactly what we did. We determined which teeth were salvageable and basically restored everything to get her back to a healthy state as is before we did any further planning. And so, let's see. Once we did that's called the caries control phase. Once that's complete, we know what we have to work with. So there were some teeth extracted on the top jaw that were not savable. And so from there, we started our definitive planning. Okay. And so what's really cool is we used digital technology for her case. She did need to take that stepwise approach to where the teeth that were removed in that area didn't have enough bone for implants. And so we sent her down to perio. So that was the team we paired up with, Prosthodontics, where they placed a sinus graft, basically. They did the sinus lift and then grafted that area for implant placement. Once that healed is where we were able to now plan for the implants to be placed, so she can have some single individual implants in those two sites. What's really cool is if planned well, and if you check your guide, this can be really, really very accurate. So from the start to finish, I had access to the software. We designed where the implants would go. We designed the guide, and that day in surgery, it turned out exactly just how we planned it, which was awesome to see, from start to beginning. Implants are in, great. She also did receive implants on the lower arch. And so basically we have at the top left, this is her and her temporaries. We are then able to communicate digitally with the lab, which is awesome. She was really adamant. If you notice in the bottom middle picture, the two teeth next to her front big two teeth, those teeth that are slightly turned, she said she wanted them to be a little crooked. She didn't want perfect teeth. And so that's what I was able to communicate with the lab, and we were able to achieve that. And so in the photo that you see on the bottom right, that's the final restorations of her top jaw, not the bottom ones. The bottoms are still in the temporary phase. And so that's when we kind of stepped it that way. We're going to finish the top and then come down to the bottom. I do not have photos of her final result, but I'm hoping to get those soon. But again, a wonderful patient. And I found, at least in my experiences, that the patients with the craziest stories often tend to be the most amazing patients to have. And so that's what I have to share with you guys. Today, I want to open it up for questions now. And I'll be happy to go back to any place that I showed. I know I moved through that pretty quickly.
Well, thank you so much, Dr. Jackson, for being with us again today and showing us these um, wonderful cases and very unique. We're gonna have our questions part now, and our first question is: are these procedures usually covered by insurance? Have you ever had a patient who needed a lot of dental work but couldn't afford it?
Absolutely. So, um, you know what? To be honest, dental insurance doesn't cover much. And my perspective is that if you have someone who's going regularly for their cleanings and maybe needs a filling here or there, it it may make sense to get dental insurance. For everyone else who falls outside of that, meaning that they typically have more needs, whether it's because of genetics or whatever, then in most instances it's not super helpful. And so sometimes it's almost just easier just to pay out of pocket because so much is not covered, which is the sad thing, but it's the honest truth. Where I actually work now, and a lot of places do this, they work with either third-party companies, such as Care Credit, to essentially help patients to afford this treatment by borrowing funds essentially on their credit. So that's an option.
Okay, thank you for that. And the next question is, how do you determine what steps are necessary to take for each case and with each patient? And what helps you determine the next step?
That's a great question. So the guiding, I guess, one of the most important things to establish early on is what are the patient's goals or objectives of the treatment? Do they want a wider smile? Do they want a brighter smile? Do they just want to eat? Do they care if it looks pretty or not? Patients will tell you this. And so that usually helps guide us, the clinicians, in determining what treatment is best for the patient. And so, what was the question again? Can you repeat it? I think there was a part I didn't answer.
Oh, yes, I can repeat it. So the question was, how do you determine what steps are necessary to take for each patient and case? And what helps you determine the next step?
Yes. Okay. So outside of the patient's own, objectives or treatment goals, we have certain principles that we learn in dental school to follow. So, for example, there's certain numbers down to the millimeter of, for example, the amount of bone needed for an implant to be placed, meaning the thickness, the amount of bone that needs to be able to hold this implant in place to survive and to integrate into the bone in the body well. And so those parameters, those are our guiding parameters. Outside of, what we know the body can do, that's basically our guide. So that'll tell us whether we need a bone graft. We also have anatomy, so anatomical borders or boundaries that we have to respect. That's also another guiding principle that'll tell us, oh, we can do this, we can't do this because of X, Y, Z. So that's part of the process in kind of the comprehensive approach to dentistry and integrating everything that you learn in dental school to be able to help guide you in those treatment planning options. Now, it's also important to know that there are multiple ways to get to the same point. And it's usually just based on preference, your experience, and that will guide you one way or the other.
All right, thank you for that, Dr. Jackson. Our next question is, do you have any hygienists in your practice? Is that like a necessary part of your practice?
So, yes, I think it's a necessary part of all practices because, patients need to be cared for on a regular basis, even more so when they have prosthetics or, restorations, anything outside of their natural teeth, which is the same as if your natural teeth, you got to go every 6 months, and we expect the same for all patients. So for sure, yes, that is a part of our practice and most practices, I'd say, and it's an important part because honestly, that's the way you catch things early, is when patients are coming to see you regularly, not taking a hike for about 4 or 5 years. and then they come back and then it's a mess. It's always best to have hygiene there, which keeps the patients and being regularly seen.
Thank you, Dr. Jackson. What sort of medications can cause or promote tooth decay?
Oh man, there's so many. And I don't know that a lot of patients know beforehand, but I also don't know that it would make a difference, because honestly, a lot of these patients are being put on medications for systemic reasons. So reasons that are probably going to impact their major organs, meaning that they probably don't have a choice. It kind of is a lose-lose, if you will. But it's something that we see pretty regularly. Most often, it's going to be drugs such as like hypertensive drugs. But I mean, there's a very large list of medications that patients can take that will do this, including, what type of drugs are these? The drugs like Adderall. I'm trying to think of the family of these drugs, but even those type of drugs can dry you out very badly. We also see patients who have had a history of cancer. And so patients with history of cancer in the head and neck, if they have radiation, I think that's probably the worst that we see. The radiation actually affects your salivary glands to the point where they're no longer producing saliva. And I think those are the patients that we see, their oral health decline very rapidly. So it's super common. I think many, if not all, dentists experience this with their patients. The nice thing is that there are some treatment options for this. There are some over-the-counter things they can buy. There's some home remedies you can advise for, and even there's some other drugs that you can make a prescription for that will help to stimulate the salivary flow, because ultimately that's what's causing the main cause behind the caries, is that you don't have the saliva flow to wash away the debris anymore. And that's a major role of saliva that you guys will learn is to literally bathe the teeth, wash away the debris, and also kind of to balance out the pH, especially when you've had an acid attack, or you've had a drink of something acidic and you're super dry. So very common we see. It's a difficult situation to kind of navigate and manage, but there are multiple ways that can be done.
I think our next question is, if you take out a partial overnight, how does that affect bone or facial support?
It's a great question. You guys are really thinking outside of the box. So with partials and any type of removable appliance, more likely than not, it is going to affect the external appearance of a patient. Not always, but in some cases, yes, especially if we're talking about a full denture, right? I mean, a denture in the mouth and out of the mouth can make someone look 20 years age difference. However, like how I've explained to most patients, it's kind of like if you went to sleep with your gym shoes on. That's not comfortable. You got to let your feet rest. You got to let your gums rest. It's kind of the same concept. And because we do have patients that they say they never take it out. And then when you take it out, you can see that the gums are screaming for help. And that's literally what you see, a lot of inflammation. And a lot of times patients just don't know. They either don't know, or what oftentimes we see as well is that they're concerned about their partners and what their partners would think about them moving their teeth. So it's kind of an insecurity or kind of interpersonal thing that's hard to deal with, especially when you have a partner that you live and sleep with. It's tough, but it's necessary. Anything removable should come out every night.
Okay, thank you, Dr. Jackson. And the next question is, how do you typically work with patients that suffer from mental illness? And are there any special like techniques or things that you do when you're working with them?
Yeah. So working with that population is really difficult. I did treat some children in the pediatric department when I was in residency and in dental school, actually. Um, and honest, I mean, you basically you just have to take your time. Um, there are techniques for adults. It's a little more difficult. I think whenever possible, um, it's best to try and sedate the patient because it allows you to be able to work more efficiently and more safely for both you and the patient. But there are also many times, where that's contraindicated for that particular patient. So it's just not an option. And when that's the case, it makes it more difficult, but not impossible. Um, it's kind of a case by case type of scenario. And the patient I mentioned earlier, I was able to get some things done. It's really the distraction techniques I think that work the best. So for her, I would have her sing. I would ask her, say, so what's your favorite song? I was like, can you hum it to me? And then that would one thing that would like let us keep going. But to the point, at some point she would just be done for the day. She's just ready to go, and she's no longer working with me, and then it just is what it is. And many patients, that's what it is. But if you can find any type of coping mechanism that works well for that patient, that maybe gets them excited or gets them kind of, focused in, it's super helpful um, in most cases for those types of patients. Yeah.
Thanks, Dr. Jackson. What is your favorite dental procedure to perform?
Huh. So, surgery is super exciting. But I don't do that as often anymore right now. That's always exhilarating. But outside of that, I think when I delivered like a brand new smile with the same day procedure, to see the patient's reactions is just priceless, because they pick up that mirror and they look and they're like literally in tears because they can't believe it's them. I have patients that have like been waiting to change their smile for many years, and I often hear a lot of sad stories. In the beginning when meeting these patients, and so, to see that transformation is amazing. So whether it's full arch immediate implants with an immediate change the same day, I think those are the most drastic and definitely very, very touching. So I love doing that, and that's what I do most of the day. Yeah.
All right, thank you, Dr. Jackson.
Yeah.
Our next one is, how do you determine how much bone you need to support an implant? And is there any way to reverse bone and gum loss without grafting?
Yes. Okay. Good question. So for that first part, again, that's why we have like those guiding parameters, and this is based off of studies that have been done over years and years that tell us, okay, these are the limits of what we need. So then we measure the bone. We can do that digitally now, or we can also do that intraorally. And so, measuring, what we need versus or when we have, those numbers to follow is fairly simple. As far as regrowing bone, that's something that research is heavy in the research now, and actually not specifically bone, but more so regrowing teeth. They're doing a lot of research on that. As far as bone loss is irreversible in itself in terms of regrowing native or natural bone. The only options after you have bone loss is, as of right now, is to basically enhance that bone with different bone. And so there's three options for that. We have bone harvested from pigs, harvested from cows, but then also a different type of bone from basically cadavers or donated bone from other humans is the source for most of the grafting that happens. The one thing that you should know, though, implants have a much higher predictability and success in a person's own native bone, as you can imagine, than a bone that maybe has been grafted, to require an implant placement. Just in general. Hope that helps.
Thank you, Dr. Jackson. And do you work with any dental assistants when doing a procedure?
Oh, yeah. Oh, yes. Their job is super important. We have really fantastic assistants. Most of the time, you have to train your assistants to whatever style and treatments and, whatever the population that you're treating in your office. So they're critical components of the dental team. Even front desk, everybody. It's like everybody, the entire team is way more important than the dentist to see that everything functions smoothly, and flows. Like literally at my job, they tell me what to do. They said, okay, Dr. Jackson, we need you here, and then we're gonna need you here. Okay, you tell me, okay, what's next? They work the whole thing. And so that really puts emphasis on the team approach, because without it, it just doesn't work out. And at the end of the day, we all keep the focus of it's about the patient. When it's about the patient and it's not about you, then we do what we got to do to get it done. And it makes for a good day. So I think that's my favorite part about dentistry. It's not a procedure, but it's just having a really good culture within the practice where everybody is on the same page. Everybody is there for the same purpose. And it just makes the whole thing fun.
Thanks, Dr. Jackson. How do you avoid miscommunication between chairside dental staff and the lab?
Who's coming up with these questions? These are good. Because that happens all the time. That's probably that's definitely can be a point of frustration, but it's a learning opportunity more than anything. And so that's when you take your assistant and you go into the lab and you talk it out together. So you say, okay, let's recap what happened. And then they take it back. Well, this happened, and then I thought this meant that. And then they were like, no, this meant that. And then like, okay, so we're gonna say that this means this, not that. And then you move forward, and it's better. But it definitely happens for sure.
Okay, next we have a more general question about why you decided to pursue dentistry and how you decided on prosthodontics in specific.
Yeah, I just had a thought with that last question. The important thing to do is confirm understanding. That's how you prevent it. So when somebody tells you to do something, okay, just to confirm, you want me to do X, Y, and Z, correct? That's how you prevent it. So my background is pretty convoluted, but in essence, my interest in dentistry started when I was in high school. I got my first internship at a dental office that was really close by. And at the time, the dentist there, he asked me what I wanted, what I was interested in school, the subjects, not what I wanted to do. And I told him I loved art ever since I was a kid. And, I found out in the first year during biology of high school that I really liked science. And he was like, well, dentistry is the perfect way to put them together. And so that's how we got that ball rolling. In addition to that, I had my own personal experiences going to the dentist. And it was interesting to be able to, contrast that experience that was in a different neighborhood, a different type of clinic, to my experience with this doctor who did, Hollywood smiles, cash only type of deal. And so, the experiences were stark. And, I wanted to be a part of of that gap that was clearly evident in terms of the care provided. And so that was a motivation as well, initially going to dental school. But my mind was made up in high school after that internship for sure. And then prosthodontics, you know, I had shadowed non-virtual. I had shadowed a prosthodontist before going to dental school. So I was aware of the specialty. I still didn't have my mind made up. And that's the one thing I recommend is just, I don't know if I said this last time, but just being open to everything. Because I think oftentimes if people go into dental school saying, I want to be this, I want to be that, then you're limiting yourself and you're kind of closing out opportunities that you don't even know you would have had, you know, interest in. And so I definitely would say take the approach of getting to know each field as much as you can, and then going from there and kind of crossing off the list as far as what you like. And that's the same approach that I took, and that's how I landed with prosthodontics, honestly.
Thank you, Dr. Jackson, for that. So what is one good quality that you see in a hygienist or like in any of your staff?
One good quality, if I had to pick one, the ability to connect. That's the biggest thing in dentistry in general. You have to be able to connect with the patient. And why is connecting to the patient important, if anybody could guess?
Provides them with a sense of comfort so that they can like relax for the procedure.
For sure, comfort is important, because if you can connect, then yeah, you can be comfortable. You don't always have to be on guard, right? There's another key thing that's super important to establishing a connection with anybody.
Trust.
Think about, what was that?
Trust.
1000%. So you have to connect to establish trust. You know, being in someone's mouth is the most vulnerable thing ever. Like, you literally eat there, you talk there, you know, you're romantic with your mouth. It's invasive. And so you have to trust someone to be able to get that close to you. And so that more than anything is related to the other types of characteristics that most committees look for when assessing applicants. You know, what is this person's ability? They want to foresee that to connect with patients at the end of the day, you know. And so you have to be open, you have to be welcoming, you know, you can't be like weird. You can be weird, but not like weird, you know. People gotta want to see you. And so that's all the things that are going through people's mind when they're interviewing and when they're reading about you. So it's just about being open and being true to who you are, because that's another thing. If you're trying to come off as something different, then they read through that and then they're like, you might make it awkward for patients. You know what I mean? And there's a learning curve. There's a certain amount of learning to get there that you can do and some strategies, but just in general, that's the big picture. Are you going to be able to connect with patients and to be able to serve your community?
When applying to dental school, what were some of the difficulties you faced? And also, what advice can you give pre-dental students who are preparing to apply for the next cycle during COVID?
The first one was which or what types of?
Yes. When applying to dental school, what were some of the difficulties you faced?
Affording it, because it's expensive. And I was working 2 jobs at the time. So I couldn't apply to 100 schools. You know, I applied to 6 schools. But that for me was still a lot. So definitely it's expensive. So I think with that, my recommendation is that really just be more specific in terms of what you're looking for, because a lot of these schools you don't have to apply to. And I do think you should take the approach of selecting schools you actually want to go to, not just saying, I just want to get in anywhere, because that's not the truth. I mean, 4 years is a long time, and it's a long time to be able to kind of mold you into the clinician you want to be. And so doing your due diligence and doing your research on these schools is super important to that. So I think that's what I would recommend most, is taking some time to think about what might be most important to you. If you don't know, reach out to some people. What are some important things to think about? You know, after you come up with whatever list you can come up with. I guess also with that is, my biggest advice is just trying to think about where you want to be long term. Because it's super nice if you can go to a school that's, you know, that has a good reputation, that's in an area you see yourself being long term, that allows you time to be able to establish a network with people in the area, so that way you're already building while you're there. And when you graduate, it's easy to transition versus, you know, going to school somewhere and then moving and having to kind of essentially start over with your network. I think that's another piece of like large advice whenever possible.
Okay, thank you, Dr. Jackson. And do you have any advice for students that are interested in specialties?
Yeah, I guess my biggest advice there is just to look at the programs and to see, you want to know like how many specialties are programs that school has. And so if that school has one or two, you probably want to look at other schools. That's another way to guide you in terms of what schools you might apply to based on that. You do want to maximize your experience. For sure.
Okay, our next question is, what are some qualities that you think that dental school admissions offices look for in applicants? And if you don't mind sharing, what schools did you apply to, and like how did you decide on those?
So qualities, you know, they want to know that you can make people feel comfortable, which means I would advise that, you know, especially for people who tend to be like super nervous, you know, rehearse, you know, and do some practice interviews with some people. That'll be helpful to give you feedback before that big day. There's some people that interviewing skills come naturally too, right? Definitely it's going to work in their favor. That doesn't mean that you shouldn't practice either, but you kind of have to know yourself. So that's one. That way you can decide, okay, well, I know that maybe my strengths aren't as much as in the interviewing area. So that's where I want to focus my energy, because there are certain skills that can be honed for interviewing. I think really the biggest help is thinking big picture, right? Which means you don't want to talk too much. You don't want to talk too much about yourself. It's nice when you're with an interviewer, you want to ask them questions that get them talking passionately about the things that they like. There are other like kind of key things to keep in mind, but overall, how are you going to be an asset to the school? What is it that you're going to bring to the school of value? And so that's what they're thinking. And so if you're thinking along the same lines, then that's where you can really connect and make an impact and an impression that is going to be lasting. And so with that, they're looking for people, like I said, who make them feel comfortable, who exhibit some type of compassion or I'm sorry, it's a passion and conviction for dentistry in general. And you have to be able to know that and articulate that very clearly. I think that's another area where people can take advantage. They kind of speak generically when it comes to that. And so the more specific you can be, I think it's very helpful and also thoughtful. And then the words that you use, just in general. They want to know that you're compassionate and that you care about everybody, you know. And so giving back is an important part of that. And being a leader in the community is an important part of that they're looking for. Those are some of the general qualities that they're looking for. And really, again, it ties all the way back to your ability to connect with anybody, because everybody needs health care. The schools I applied to, if I can remember them all, I know I don't remember them all, but UNC, which is where I went, was the very last school I applied to. And that was probably like, I got the last interview in January. So that was at the very, very end. It was a kind of an afterthought, but I ended up going there. I applied to Maryland. That was the school I initially decided to go to, paid my deposit and everything, and I switched at the last minute. I applied to Michigan. I applied to UIC in Chicago. I applied to USC, which I would, and looking back, I would have never applied to that school if I would have known the tuition costs. And so that's where I didn't do my due diligence, but I applied there because my twin brother lives in LA. And I was like, well, it would be nice to be closer to him. So that was a good reason. I want to say I applied to like Kentucky, maybe Kentucky. I don't know how many schools that is so far, but I know it was like 6. And I might be missing 1 or 2, but I knew it was according to location, and also reputation and access to multiple specialties and having those experiences. Tuition cost was a big factor, and super big factor was my ability to gain in-state tuition. So those are the biggies for me.
And how was the transition between dental school and I guess working on your own, maybe in residency or...
Yeah, so I was telling another student yesterday about that transition. You know, it's funny because when you're in dental school, you like think it's like, oh my gosh, this is so hard. Like, how do people do this? Like, you know, like I remember some days it's just like, yeah, it was hard. It's gonna be hard. But then I got into residency and I was just like dental school should have been a breeze. Like, because this is just ridiculous. And that's just the way that life works. It's like every time you hit another level, you're like, I don't even know, how did I even get here? Like, you know, you surpass levels that you think that you could never achieve. And it just keeps going up. It's really all it is, you know, because still to this day, I thought dental school was so hard. It wasn't, you know, impossible, but it was very, very difficult. But then I got into residency, that was a whole nother level. It was a whole nother level. And I probably think that I can't surpass that, you know, and I'm not trying to go back to school. I'm not, but I'm sure if I wanted to, I could. And so that's just to kind of keep you encouraged that, you know, I don't know, there's a lot of things that seem surmountable until you achieve it. And then it's like, oh, it wasn't as bad. It's all mental, I think.
You said residency was just like on a completely different level than dental school. Could you describe a little bit about like what made it like just like another notch up?
So like, okay, so there's one component. There's a component of your didactic component. There's just a lot of material. It's much more dense. It's more focused, but it's definitely more dense. But I think the biggest factor was the physical component. So dental school required a lot of hours, but I think most of that time was like reading, studying, specifically for prosthodontics. There's a lot of lab work that goes on behind the scenes, and there's a lot of physical labor. You can imagine, you know, prepping a crown, single crown versus a whole mouth. I literally would have patients in a chair from 9 a.m. until 6 p.m. with a 30-minute break, lunch break. And so, you know, in residency, I threw my back out. I did all this stuff, but it's, you know, it's all like to get you the most out of that very short time. And looking back, 3 years, you know, 3 years was a lot, but also it seemed like wasn't enough. And even though I know so much more than I would have known without doing it, it's still like taxing on the body. And so, for example, the hours that you put in. You know, I would be at the school at like 7 a.m., maybe doing some lab work for a couple hours. Then we might have a treatment planning session for about 2 hours. Then I'm seeing my first patient. And that might be the patient I see all day until 5 or 6. You're supposed to be done at 5. Sometimes we were there until 7:30 at night. And then at 7:30, as the patient leaves, you have lab work and you're there until 10:30. So I was on average at school until at least 10 o'clock every night. At least there was even one night where I nearly spent the night. You know, and that's borderline. That's unhealthy. But you know, it's just there's times like that, and I think reminding yourself that all of this is temporary, because all it is, everything is just temporary, is what helps get you through. And even, you know, going through all of that, day in, day out, like even coming in on the weekends, you know, it takes a lot of commitment. And when you're investing in yourself, you know, it's just a part of the process and part of the journey. And take it in stride and you just keep going, even though it's hard. So definitely, I would say it's just the lack of sleep and actually, like, you know, being up that time and actually physically moving and working that whole time. It's not like you're just sitting and reading the book. You're moving and working, like, so that physical part for sure.
Thank you, Dr. Jackson. So that is actually our last question for this session today. And we really appreciate you coming back with us and just like talking about your cases and what it's like to be a prosthodontist again. And for those of you pre-dental students who are tuning in, the quiz will be posted in the chat and also on the GroupMe. And thank you again, Dr. Jackson, for taking your time to talk to us.
Yeah, thanks for joining us this afternoon, guys. I hope everyone has a wonderful holiday.
Thank you, you too.
Thank you.